Hi, my name is Kate McCracken, and the purpose of this video is to demonstrate a hospital notification via DMIST over phone or radio and a MICA handover using the isobar technique. We're filming on the 21st of May 2014 and my student number is 26023180. Standard precautions, gloves and goggles. Hi, I'm Kate. The patient we have here is Michael Creed. He's a 56-year-old male and lives independently at his home in Seaford. He's called us today after he'd lost consciousness for approximately 10 on 60 and he woke with pain down his left arm, approximately 5 out of 10 pain. Observations showed heart rate of 96, which was regular, confirmed on the ECG. His rest rate was 26, short, shallow breaths. His BSL was 6.2 and his blood pressure was 140/85. His GCS was 14, a little bit confused, and his oxygen saturation was 93%. He was clammy, pale, cyanosed lips, hasn't taken any meds in a couple of days. We also palpated a hematoma on the posterior of his skull in the occipital region. So he's a type 2 diabetic, which he takes Diabex for. He's allergic to morphine, he breaks out in a rash. He also has hypertension, which he takes Atican for, and hyperlipidemia, which he takes Lipitor for. He's a heavy smoker for 40 years, pack a day, and he also has ETOH abuse. He has an extensive family history of ischemic heart disease, and so we want to investigate a possible cardiac issue. So we gave him treatment for the pain in his arm, which we gave him 25 micrograms of fentanyl, and then we also gave him oxygen via nasal prongs for 4 litres per minute. He responded well to that. His oxygen sats went up to 98%, pain dropped from 5 to a 1, his heart rate went down to 80, BP went to 130/80, GCS rose to 15, and his rest rate went down to 16. So yeah, we've called for the elevated rest rate, and also because the pain down his arm could also be related to a cardiac issue. Hi, this is Kate from Seaford 1. We have a 56-year-old male from his home in Seaford. He lives independently but had a fall in his home. He had loss of consciousness for 10 on 60 and he woke with a 5 out of 10 pain in his left arm and a minor hematoma on posterior of skull. He has history of type 2 diabetes, which he takes Diabex for, high cholesterol, which he takes Lipitor for, and hypertension, which he takes Atican for. He also has extensive family history of ischemic heart disease and is allergic to morphine. Current obs show heart rate of 80, oxygen sats of 98 on oxygenated air, which we've given him, BP 130/80, BSL 6.2, and rest rate of 16 with nil effort. His GCS has also risen to 15. He's been treated with 25 micrograms of fentanyl, which has decreased his pain from 5 to a 1. His oxygen via nasal prongs has increased his sats up to 98% on 4 litres per minute. He's responded well and has improved, but potential cardiac issues still concerning, probably 7 minutes ETA.